Public services are being transformed by technology and new digital infrastructure, with healthcare being a service that we and our families will likely depend on at some point. Cardiff Vale University Health Board provides key health services from its various hospital and community locations, and in Cardiff hosts Wales's main tertiary hospital, the largest teaching hospital in Wales, and the Noah's Ark Children's Hospital for Wales. Over 14,000 staff now rely on fast and secure PSBA connectivity to deliver Cardiff and Vale's vision of healthcare without boundaries to the population they serve. Everything is time critical, and the IT network infrastructure needs to be there 24/7, not just for staff and partners, but also for the people using their services. Cardiff and Vale University Health Board serves two unitary authorities, City of Cardiff Council and Vale of Glamorgan Council, with the PSBA providing two-way connectivity for clinical services in all its hospitals and community mental health bases through a single secure circuit. Like most large organisations, staff can also work remotely via secure internet-facing access to clinical and business applications, as well as accessing a large and expanding free patient Wi-Fi service funded by its health charity.
Here at our monitoring centre, we have a secure network for our patient Wi-Fi and our academia Wi-Fi. This is one of the controllers that monitors that. As one of the UK's largest teaching hospitals, we have a lot of academia traffic passing through our Wi-Fi. So we'll have a quick look and see how much is currently going through in the last 90 seconds. We're currently seeing around 500 megabytes of academia traffic. And if we combine that with what we see with our free patient Wi-Fi service, we are looking at 2.5 gigabytes every 90 seconds passing through the PSBA.
As healthcare covers a wide range of specialist disciplines, Cardiff and Vale depend on the resilience and speed of the PSBA to deliver a range of essential business and clinical services in its own locations and at partner sites on over 12,000 digital devices.
Digital Health Bureau at Cardiff and Vale University Health Board, we are running a project currently to digitise our records to make them available to our clinicians via our clinical portal. Multiple users can view these records at the same time, and they're of a very high quality. They can compare these records to our letters, and the emergency unit episodes are also available to our GPs out in the community, where they can see the episodes where the patient has attended.
My name is Hayden Mayo and I'm a GP at North Cardiff Medical Centre. We're a large suburban general practice in the north of Cardiff, and we deliver healthcare services for 15,000 patients. Over the past 10 years or so, we've seen some dramatic improvements in the information technology services available to us, and through the Cardiff and Vale Health Board clinical portal, we have a suite of facilities that provide efficient and reliable healthcare support services. That means on a daily basis, I can access information in relation to patient blood test results. I can message my consultant colleagues in our e-advice suite. I can make electronic referrals, and I receive electronic discharge information on the same day that a patient is discharged. There are major benefits both in terms of our governance, but also in terms of patient safety.
In an earlier phase of my career, I can remember working in hospitals where MRI scanners were being introduced for the first time. Their initial utilisation was actually a lot less than expected because people weren't used to having the facility. They'd constrained themselves to working without it, and it took a little while to appreciate, and then of course once people did start to appreciate what was available, the bottleneck appears again. But I think that we're in that phase as far as bandwidth and exchanging healthcare information. There are so many things that we don't exchange at the moment because we've not been able to. The new IT systems often shine a light on practices that are a bit outdated, and that clearly is a cultural change, and you need clinical leaders to foster the mindset to get that across an organisation.
At present, we are able to put still images through PACS system. But still images have their limitations. If we have fast bandwidth, that technology will allow us to push moving images of heart even at a rate of 150, 160, 200. Not only in small babies, but even in unborn babies, in order the specialists at UHW to comment on those images, give instant advice to their colleagues in as remote parts in Wales as possible. Instantly reassure parents, initiate treatment, make diagnosis, give counseling, and also prevent unnecessary transfer of these babies all the way from West Wales to Cardiff. Benefits are multiple.
The move to digital imaging has resulted in what I call the Doctor Who effect, so that's the removal of geographical and time boundaries. So whereas in the past we'd had to produce a hard copy image, and now everything is available anytime, any place, anywhere. That means that we have no lost images. It means that any clinician who has access to the system has been adequately trained can access that image simultaneously. They can share images with their colleagues, and the move to the high bandwidth modalities means that we can push far more patients through the system much faster.
Secure internet-facing services allow not just staff at hospital sites to benefit from high bandwidth, but also patients accessing services remotely and clinical staff working off-site.
So this is Track. It's a website which allows patients to treat their own knee condition. It can be used in the physiotherapy department with their physiotherapist, but also at home patients can access it. Provides people with information. They can remotely email their physiotherapist to ask questions about their recovery, but it also provides them with personalised exercise plans. So one of the benefits to the NHS is that this is totally free to use. Patients can access the website at home. There's no cost, and you can access it on any type of device, from your mobile phone through to your PC.
Most of my work is digitally driven. There are hands-on situations when I have to be in the hospital, but most of my work, including on-call work, can be done very effectively from home with proper access. What that allows is instant specialist opinion to my consultant colleagues, wherever they are, using whatever facility they've got, that we can have an instant discussion and an instant patient management plan while the patient is still there in clinic. It gives the consultant the confidence to manage the patient. It gives the patient the best possible care. I don't need somebody to pay me to sit in a hospital for 24 hours a day. It's much easier to provide that from home, and the current facilities with the internet access that we have would allow us to do that.
MedicBleep is a communication system for professionals, healthcare professionals. We're all comfortable using the social media communications. However, when it comes to healthcare communications, we have to be very careful, and to prevent breach in patient safety and patient information, it's essential that we communicate using a secure channel which is guided by the information governance. So in this way, we'll be able to speak to each other securely and get the right decisions made for our patients in a time-bound manner, which will help in the overall patient care.
As a senior partner in a busy general practice, there is no doubt in my mind that having fast and efficient and reliable IT underpins absolutely everything that we do. And the more we can grasp the developments available to us, I'm sure we can improve those efficiencies and deliver even more and better healthcare services for patients.
The flexibility of mobile devices currently and the Wi-Fi access within the hospital has revolutionised the way consultants do their ward rounds in clinics. I don't have a secretary, and that this is how most of my colleagues will now contact me, and they're very comfortable and confident that this system works. And that's a revolution in the way we're delivering joined up care in the NHS.
Every Christmas, Cardiff and Vale Health Board staff and technology partners depend on the PSBA to deliver fun and light relief to younger patients with a personal video conference with Santa.
Merry Christmas!
PSBA, the network connecting the public sector in Wales.